I will talk about osteoarthritis now and how it relates to mobility, the concept of mobility. So just as a reminder, the concept of mobility, first the way the musculoskeletal system works with the circulatory and nervous system to allow for movement. One thing to know here is that this is very different from osteoporosis. Students sometimes get the two confused, but if you know your prefixes and suffixes, you can break these words down to figure out what they mean. So osteo, of course, always refers to bone. The middle section here, arth, refers to joint, and itis is inflammation. Sometimes you'll see us just use OA, an abbreviation for osteoarthritis. So this occurs slowly over time. The cartilage in the joint starts to wear down. It can become so severe that there's no longer any cartilage there, and then you have bone on bone rubbing together. And that's when you start to see these bone spurs form, and it becomes very painful and it limits movement. So it does progress slowly over time. It's not something that we can reverse once it's happened, but there are some things that we can do to hopefully slow the progression down and keep that joint mobile as long as possible, and we can also treat the pain that comes along with it. So the risk factors are very different from osteoporosis too. So the age, the higher the age, the greater the risk of developing this is. We usually see it in people who are older than 65. Women are at a greater risk. Obesity is a risk factor, very different from osteoporosis, where having a small frame is a risk factor. Any previous injuries, especially if there's a repetitive movement to one area. So sometimes sports injuries, we'll see this. Also occupational hazards, if there's certain movement that you do repetitively throughout the day. Like a mechanic or, even nurses using their knees and joints constantly. Those are risk factors. Genetics does play a factor in it, and then any bone deformities, and that could come from fractures. Over time, it starts to wear and can break that cartilage down. Pain is going to be probably the #1 complaint that you'll see. There may also be tenderness and stiffness in that joint, especially if someone hasn't moved in a while and they are trying to get up. So, for example, getting up in the morning, everything's very stiff and not very flexible. You may see or hear or feel crepitus in that area, and that it's bone rubbing on bone, so it kind of feels like Rice Krispies almost. And then you may see those bone spurs start to form in the area where the bones are rubbing, and that's kind of like scar tissue. So we'll diagnose this through a physical assessment. They may also do x-rays and MRIs of that joint. We may do a joint fluid analysis just to see if there's any bacteria forming in that joint, or to see if there's any uric acid crystals, which could tell us if this is a gouty joint versus osteoarthritis. Blood tests are pretty non-specific, although we may do CBC just to look for a white count to see if there's infection. We may do a sedimentation rate to look for inflammation. Other than that, the only other test we may do is a rheumatoid factor to see if this is a rheumatoid arthritis versus an osteoarthritis. So treatment focuses on pain and movement. So we may give acetaminophen or any NSAIDs to help with that pain. Just know with NSAIDs we need to be careful because they can be a little rough on the GI tract. So we probably want this person to take this with meals, especially naproxen and celecoxib. Teach them that if they notice any bleeding in their stool or dark stools that they need to let their healthcare provider know. We may have to give like pantoprazole, omeprazole, or esomeprazole along with these to try to prevent that from happening. Duloxetine may help. We may do topical creams to that joint. Exercising that joint helps with the blood flow there and kind of prevents the breakdown of that cartilage, so make sure the person's mobile. If they are obese, we may need to do some teaching on weight loss. Heat and cold therapy may help. Physical and occupational therapy, just know the difference between these two. So physical therapy focuses on the actual movement of the joint, and occupational therapy focuses more on function. So you may see in occupational therapy people are like, putting on shoes or making a meal, just demonstrating that they can perform those functions. Or in physical therapy, they may just be doing exercises. There are some really good alternative therapies like yoga and Tai Chi. Those are really great for joint movement and range of motion. We may do some injections to the site. So cortisone is steroid injection, helps with inflammation. And this hyaluronic acid is just a normal component that is found in synovial fluid that can be helpful. Occupational or acupuncture can be helpful too. And then we may do some surgery. Surgery is always going to be a last resort because it's invasive, but we may irrigate that joint. They may do some joint resurfacing, which is where we just put a piece of metal over the bone so it's not bone rubbing on bone. We may do an osteotomy, which is removal of like fragments of bone if there's certain areas that are really rubbing together, and also realigns the bone. If it's a joint that we can fuse together, they may do that. Arthroplasty is a joint replacement. That's always going to be the last resort because these joint replacements don't last for a very long time, maybe 10 to 15 years before they fail. So we don't want to do that in a very young person and then have that joint fail and then we don't have any more options after that. So we'll try to prolong this as long as possible, treat the pain, and try to do physical therapy and these other things before we'll move to a joint replacement. And then complications are just that it's going to get worse over time. So the pain gets worse, the stiffness gets worse, and the mobility in that joint gets worse over time. All right, so make sure that you read about this in your book and come to class with any questions or anything that we didn't cover in this short little lecture.